Hi, my name is Sarah. I'm a student nurse, and I will be administering penicillin G sodium, 3 million units IV, for my patient, Tim Smith. It is due at 0900 hours, so I will be giving it now, which is 900 hours, and I'll be administering it via CIVA pump. My patient has no known allergies, and he is getting this, which is an antibiotic for an infection on his leg. So I'll begin by comparing the medication I've drawn up from the Pyxis machine with my mark. So I have penicillin G sodium, 3 million units, so I've grabbed my 5 million unit vial, and I'll be reconstituting to achieve 3 million units. I've checked the expiration date, it is not expired, and I will begin by reconstituting it with sodium. Okay. So now that I've looked at my monograph, I see that the maximum single dose is 5 million units, so 3 million falls within that range. The usual dose is 1 to 4, so 3 million is an acceptable dose. And the maximum daily dose is 30 million, so again, my dose is within the range. To reconstitute 5 million units, which is my vial, I'll need to add 3.1 milliliters of normal saline, and to achieve a final volume of 5 milliliters. So the final concentration would be 1 million units per milliliter. So I will need 3 milliliters to get 3 million units. Okay. And I'll be administering this via the CIVA pump. So that's my first med check done. So I'll start preparing the medication. But before I do that, I'm going to wash my hands. Okay, so now I'm ready to prepare my medication. I'm going to wipe off this for 30 seconds and allow it to dry for 10 seconds. And I'm going to alcohol swab this one for 30 seconds and allow it to dry for 10 seconds. Oops. So I'm going to drop my normal saline to reconstitute my medication. So I'm going to pull back 3.1 milliliters of air, which was the amount stated on the monograph. I'm going to inject it into normal saline. Then I'm going to pull out 3.1 milliliters of normal saline. And I just have a couple bubbles. Okay, so now I have 3.1 milliliters. I'm going to inject it into my medication vial. And to reconstitute, I'm going to roll between my hands to avoid making bubbles, which is why I don't shake it. Okay, now since nothing has touched the top, it is still sterile. So I can take out my 3 milliliters. So I'll inject 3 milliliters of air. And then I'm drawing up 3 milliliters of my medication. So now I have exactly 3 milliliters of my medication. So now I'm going to do my second med check. So penicillin G sodium, 3 million units. I've reconstituted to 5 million at a concentration of 1 million per ml. So if I drew up 3 milliliters, that would be 3 million units, and that's how much I need to give at this time. Okay, so now I'm going to get my CIVA pump organized. One sec. So I need to swab my mini bag for 30 seconds and allow it to dry for 10 seconds. And I'm not going to let anything touch that port to maintain sterility. And according to my sheet here, I need to draw up 30 milliliters in a 30 milliliter syringe for 3 million units. So I'll draw up 27 milliliters so that I can add my 3 milliliters of medication to achieve a final volume of 30 milliliters. So get rid of my bubbles. Okay, and now I'm going to pull back 3 milliliters to get some air in there. And then I'm going to inject my medication. So now I have a final volume of 30 milliliters. I have my med label here, which is penicillin G sodium, 3 million units at a concentration of 1 million units per ml. I have the date, time, and my signature. So I'm going to attach that to my medication. And I'm going to put on a lid as I bring it to the bedside. Okay, so now I'm going to take my table over to the bedside. See here. Hi, my name is Sarah.
Hello, my name is Jonathan. I'm a student nurse at the University of
I'm a student nurse, and I will be administering your penicillin. It's for an infection on your leg.
So the first thing I'll be doing
is it okay if I give you this medication? And if you have any side effects, which could be any nausea, diarrhea, any stomach issues, please use your call bell and let me know. And I'm assessing the IV site. It looks pain. There's no signs of infiltration or phlebitis, so I can continue with my administration. Okay, so I'm going to get my line primed.
And as I say, dry out. So at this point,
do you have any allergies?
Like order anymore?
No. And the MAR says no known allergies.
My hygiene.
And I'm going to do my third check at the bedside. So penicillin G sodium, 3 million units, and my MAR says 3 million units, 9 o'clock, it's 9 o'clock. And the right patient, I've looked at the wristband, compared the wristband to the MAR, no known allergies, no known allergies, it's the right time, right route is IV, right dose, 3 million units. So now I can get my IV set up.
Now I will proceed and check the monograph pulse.
And I'll ensure nothing touches the ends of my ports.
Expiry date. My vial is not expired, that's good. Conforming to the monograph, fluoxetine, medication. It's an antibiotic, it makes sense, it's for my patient pneumonia. This medication can be administered by a nurse and a student nurse. So the usual dose is
I'm just going to prime my line.
1,000
So I see a drip at the end.
My desired dose is 1,000 milligrams, so it's within that usual and safe range. So the Constitution policy states for a 2,000 milligram vial, I need to add 6.8 ml sterile water.
Okay, so now that I've seen the drip at the end, my line is officially primed.
Per ml, and a final volume of 8 ml. Perfect. So what I will do now is I will clean my vials,
okay, and I'll assess.
Using alcohol swabs.
I'll refer to my chart here to see at what rate. So for penicillin sodium, 3 million units, 30 milliliters in a 30 milliliter syringe, I would go over 35 minutes, and it's in normal saline, and it is normal saline that is hanging, so it's compatible. I will choose a port that is after the pump so that the CIVA can regulate the rate.
So the monograph states I need that 6.8
and
ml
I forgot one of my alcohol swabs, so I'm just going to use the call bell to ask for one.
I'll be using
Thank you. And I'll swab the port for 30 seconds.
So I need transport air equivalent to the
and allow it to dry for 10. And since this is still sterile from the packaging, nothing has touched it, I can hook it up to the IV. And before I start the IV, I'll make sure nothing is clamped, so this isn't clamped. Everything's good. And my clamp is off here, and I'll just untangle a little bit. Perfect. And then I will start my IV.
My desired dose.
And then as long as these green lights are flashing, I know that it's infusing. I can come back to check to make sure the green lights are still flashing. I'd started at a normal rate because that's 35 minutes, which is the same as my drug administration, so it's to start at a normal setting for 35 minutes. So I'll come back in about 5 minutes to make sure it's down to the 30-minute line. And after the 35 minutes, after this is all infused, I would flush afterwards with 3 to 5 milliliters of normal saline to get all the medication infused into the patient. And if he has any questions, he can reach me with the call bell, and I would go document this and come back and evaluate the effectiveness. And yeah, I think that's everything. Okay.